CBC News has learned Ontario will make a formal request to the federal government for more than 600 critical care staff to support the province's hospitals. The situation in Ontario's hospitals is dire. More than 1,900 people are in them with COVID-19. Of those, 659 patients are in intensive care. That's a new high during this pandemic. So what is it like to be on the front lines of this pandemic? Clare Fielding is a nurse manager in the medical surgery ICU at Toronto General Hospital, which is a part of the University Health Network. She joins us now from Toronto. Hi, Ms. Fielding. Good to have you on the program. Thank you very much for making the time.
Thank you for having me.
What is it like in the ICU where you work right now?
Very busy. People are very stretched. They are very stressed and they are very anxious. The workload is intensifying, and the distress both from the patients and families and the caregivers is getting quite high.
And what about the portion of those patients who are there with COVID-19? Have you seen the increase we've seen more broadly across the province?
Yes, for sure. The center I work at is an ECLS center, so we see the patients who can't be managed at the other centers brought to us to be put on heart-lung bypass machines in order to manage their illness and rest their lungs and hopefully give them a chance to heal. But we're seeing the intensity of that, the numbers of that, the amount of people who are requiring that advanced therapy is going up and up.
And are you seeing that those patients who require that are younger? Again, anecdotally, we've heard that across the province. Are you seeing evidence of that as well?
It's absolutely, for sure. Yeah, these are 20, 30, 40-year-olds this time around.
And I hope this doesn't sound like a naive question, but I feel like we keep saying, oh, this many people are in the ICU, this many people are in the hospital. You mentioned, for example, the help they're getting in the ICU. Like, what does it mean to be in the ICU with COVID?
It means you are sedated on very high doses of medications. You are paralyzed. You are on a breathing machine. You are, in my center, you're also on an ECLS circuit, which means your blood is taken out of your body and pumped through a machine to add oxygen and take away waste. You are often on dialysis to assist failing kidneys. You are on blood pressure medication to improve the functioning of your heart. You are being monitored for blood clots, for bleeding, for strokes. You are being turned and proned and being very vigilantly watched for skin that break down and damage, knowing that pressure ulcers and the infections associated with them can be just as harmful. You're being managed with central lines, arterial lines. You've often got chest tubes and other supportive devices attached to you. You're being fed through a tube, through your nose. Like, this is the most unnatural environment ever. Every part of your body is being managed by a nurse and a respiratory therapist and a perfusionist and a physician. And you've got OTs and PTs and dietitians all working together with social work and spiritual care to provide you with what you need to survive, just to support your body so that you can start to heal and to support your family, because they are not coming to see you. You are isolated. And if you were awake, you would see us in our masks and our shields and our yellow gowns and our blue gloves, and you would think you're on Mars.
What is it like to be in that environment so intensely right now?
It is absolutely exhausting. And you can see that in the strain and the stress of the team as they come together. Our focus is just to get through this 12 hours with this patient and do everything we can to make sure they survive this shift. And every shift is like this. And the calls keep coming and people keep arriving. And we're now at the point of decanting our centers to hospitals that have less volume or are not providing ECLS in order to make space for those patients who do require that advanced therapy. And so you have an extremely sick patient, but you're putting them on a stretcher and then sending them somewhere else so that you can get someone who is even sicker and requiring more help.
Have you ever experienced anything like that?
No one's experienced anything like this before.
And when you talk about all the different trained professionals that are required, who are required to treat that individual, how concerned
Yes.
are you about resource levels?
Well, of course, we've been talking about nothing but leading up to the third wave, or actually even from the beginning, from the first wave. What are we going to do when the patients exceed our nursing care capacity, when we have too many patients and not enough beds? So right from the beginning, we've been bringing in ward nurses and giving them ICU experiences and buddying them with ICU nurses so that they'll be able to support the care of these patients. Physiotherapists have been coming in, helping us with proning and positioning. Respiratory therapists and, more importantly, respiratory therapy students have really stepped up to provide care and to come and work in the units, even though they're still in their schooling. It's been really incredible to see everyone come together, and it's really shocking that we are having to put in play the plans that we've been making to have buddy nursing, to have team nursing, to have all of these different disciplines stepping into roles that they've never had to do before, and to ensure that when we all come out the other side of this, that those people are not broken from their experience.
I have to imagine that that's a big part of the consideration. Like the way, it's hard to listen to what you're describing it. You and your colleagues are living it. Are you worried about the other side?
Absolutely. We have a standard of care that we've all been trained on, and we all know it. And we are being asked to do less than we would normally do in order to be able to provide care to more people. And so in doing that, we know that there are things we are not able to do. And we all have great fear that we'll miss something, that we'll make a mistake, like something will happen because we weren't there, because we were over providing care for someone else in that moment. What do you do when two cases side by side start to have a cardiac arrest? Where do you get the people from to run that code if everyone is as stretched, as thin as we are planning on becoming stretched? It's a real fear. And so we spend a lot of time working on our resilience and managing our stress and supporting each other, because when these things do happen, we need to make sure that nurse and that medical team and those RTs come out the other side able to continue to provide care and not have to go off because we've broken them.
I can see the weight of it is bearing on you quite a bit.
Yeah, it's been a long year.
Well, I know I speak for everyone watching when I thank you and your colleagues for all you're doing, and hopefully it won't be like this for much longer. Thank you very much, Ms. Fielding. It's very nice to meet you, and I appreciate you making the time.
Not a problem. Have a good night.
You too. Clare Fielding is nurse manager in the medical surgery ICU at Toronto General Hospital. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.